The big debate this week is about the public option, the idea of a government health plan that would get some competition going with private insurers. This is what you said about the so-called public option back in June. Bottom line is that we need to rework our healthcare system. Providing a robust public plan option is an essential part of the solution. Do you stand by that? Is it still essential?
Yes, it is. It is not a mandate, it's an option. If you like your present insurance, whether you're an employer or an individual, you keep it, and it doesn't change.
Senator Schumer,
if you don't like it, you have an option of the public option, which will help bring costs down. And so it is indeed essential to getting the costs down, which is our #1 problem.
Remember, our whole principle here is to offer people choices. So people do have choices today if they can get health insurance. If you have a public option and you eventually get to only one option, then there's no choices. And choice of different plans is what we want to preserve for America.
You say it's essential, Senator Schumer. The president's saying now it's just a sliver. He's backed away, hasn't he?
I don't think he's backed away at all. I've talked to the president personally about this in the last few weeks. He believes strongly in the public option. Obviously, he is working hard to get a bipartisan bill because that would be a better bill. But I believe that at the end of the day, we will have a public option. And frankly, I believe we could get a public option that could be passed with the 60 Democratic votes we had.
It is very clear that in the United States Senate, the public option does not have the votes. If we have to get to 60 votes, you cannot get there with public option.
Obviously, we are going to try to get a bipartisan bill, but a public option to many, many objective observers is essential to bringing those costs down because it provides competition, and at the end of the day, we will have one. We will have one, because I believe even if every Republican says that they will not be for a public option, we can find a level playing field, level playing field type public option where both insurance companies and this option compete, and we will get 60 Democratic votes for it.
Morally, every one of us would like to cover every American with health insurance. But that's where you spend most of the $1 trillion plus, or a little less, that is estimated. The estimate said this health care plan will cost. And I'm afraid we've got to think about putting a lot of that off until the economy's out of recession. There's no reason we have to do it all now, but we do have to get started. I think it's a real mistake to try to jam through the total health insurance reform, health care reform plan that the public is either opposed to or are very, very passionate mixed minds about. It's just not good for the system. Frankly, it won't be good for the Obama presidency. I think because he's got other fights to fight. People on the Finance Committee, which I think remains our great hope now, these 6 people, 3 Democrats, 3 Republicans working together. That's the hope to get things done. They've said to me that they agree on about 3/4 of what needs to be done. Let's do the 3/4 and save the other quarter for a day when the economy is growing and maybe we've done something to turn down the deficit.
The president also says that the debate has been infected by falsehoods. Probably the most notorious one is the one made by your former running mate, Sarah Palin, who said that his bill would encourage death panels that would encourage euthanasia. He called that an extraordinary lie, and he is right about that, isn't he?
Well, I think that what we are talking about here is are we going to have groups that actually advise people as these decisions are made later in life?
That's not in the bill.
But it's been taken out. But the way that it was written made it a little bit ambiguous. And another thing,
I don't think that's correct, Senator. The bill, all it said was that if a patient wanted to have a Medicare consultation about end-of-life issues, they could have it at their request, and the doctor would get reimbursed for it. No panel.
But there was a provision in the bill that talks about a board that would decide the most effective measures to provide health care for people, okay?
So you think Sarah Palin was right?
Oh, look, I don't think they were, quote, death panels. Don't get me wrong. I don't think. But on the best treatment procedures, part of the bill, it does open it up to decisions being made that should be left, those choices left to the patient and the individual.